Good evening, everybody. Welcome to the Shielding Trainee webinar series. Tonight's session is Supported Return to Training for Shielding Trainees, which is an introduction to the Supported Return to Training programme and some of the resources available to trainees who've been shielding or stringently social distancing during COVID-19. This is one of a series of Supported Return to Training shielding webinars run by HEE. I'm Ceri Chadwick. I'm a National Clinical Fellow for Supported Return to Training and a Paediatric Registrar. Now, first of all, I would like to launch a poll via screen share, so just give me a moment to bring that up, just to get an idea as to what the audience is made up of, and you might find it interesting to see what region people are from or what reasons they may be shielding for. If I scroll down through region, there's a number within the East Midlands, North West, London, North East and North Cumbria, South West, Yorkshire and Humber, Thames Valley, Wessex, East of England, West Midlands, Scotland. So you can answer this next question. It should come up for you. It would be interesting to get a sense as to how the expected pause in shielding has affected you and what your returning plans are. See that the biggest number, 38%, are planning to return soon. And from discussions we've had, many of those will be over the next few days. And the next question is the reason for shielding or stringently social distancing. There will be many, many reasons and slightly individual circumstances, but just to get a feeling as to what the group is made up of. And we can see that there are many shielding for medical and personal reasons, the biggest group at almost 70%, but there's also some supervisors and trainers, some that are shielding due to pregnancy, and some that are shielding by proxy. I'm now going to hand over to Aimee Manicom, who is one of the Clinical Fellows for Quality Improvement in HEE in Thames Valley, to give us an overview of the Supported Return to Training programme. Over to you, Aimee.
Thanks, Ceri. Good evening, everybody. My name is Aimee Manicom. I am an Anaesthetic Registrar and also a Quality Improvement Fellow for Health Education England in Thames Valley, working on the Supported Return to Training programme. Tonight, I'm going to be giving you a very brief introduction to Supported Return to Training, what it's all about, where it all started, especially for those of you who may not have heard about the programme before. I'm going to start with a short video, which I think really nicely sums up Supported Return to Training. It's available on YouTube and the HE website if you'd like to watch it again after this.
1 in 10 postgraduate doctors will be taking approved time out of their training at any point. This is a normal and expected part of many doctors' progression through training and is being recognised as such. The 2016 ACAS contract agreement committed Health Education England to removing as far as possible the disadvantage of those who need to take time out. This could be through sickness or taking parental leave, being out of programme for research, a career break, or for additional training, working abroad or on military leave. There are any number of valid reasons. Returning, though, can seem a daunting prospect. Will you be up to it? How many skills have become rusty? Or how will you cope with your new life circumstances? That's where support can step in. It's available across England and includes things like accelerated learning and refresher courses, supported and enhanced supervision, mentoring, and help with accessing supernumerary periods. Support is for any trainee who has taken time out of training for any reason. Contact your local Health Education England office for more details.
So as we saw in the video, at any given time, approximately 10% of trainees, that is about 5,000 trainees of the 50,000 medical trainees, are taking approved time out of training. It's very well recognized that taking time out of training for a variety of reasons is a completely normal and expected part of doctors' progression through training. I'm sure most of you will remember the 2016 junior doctor contract negotiations. Prior to introduction of that contract, there was an equality assessment which was conducted and showed that the proposed changes in pay with the contract would impact those who take longer to progress through training and therefore get to posts with higher levels of responsibility and pay. So that means that it could affect trainees who had needed extended time during their training, or who had taken time out of training to undertake research or follow other interests that they had. It would also affect trainees who were on clinical academic training pathways and those that had chosen to re-specialize in different fields. It would also affect those trainees who had ill health or disability, or who had taken time out for parental leave, or who had decided to train less than full time as well. So on the back of that, there came a commitment to develop innovative approaches to training to remove as far as possible the disadvantage to those who take time out of training. And from that, the HEE Supported Return to Training project was born. It was introduced in 2017 with substantial funding, and it aimed to standardize return to work process across all specialties and provide funding to support returners' activities, to upskill educators, and to develop innovative ideas. In 2016, in March 2016, the Enhancing Junior Doctors Working Lives program was introduced as well. And this was introduced to address a range of issues which were having a negative impact on the quality of life of junior doctors in training. Flexible training was identified as a key agenda in enhancing junior doctors' working lives. Flexibility in training is very important to maintain a healthy work-life balance, and also to allow trainees to take time out to develop their skills further. So Health Education England has committed to introduce flexibility into training with increased opportunities, for example, for trainees to work less than full time, or to easily take time out of training for a variety of reasons. And of course, connected to that is to provide a good supported return to training when they come back to training. If you want to find out more information about that, the Enhancing Junior Doctors Working Lives annual report is an excellent document. But what are the concerns of returning trainees? Now, I personally haven't been shielding during this time, but as someone who's taken time out of training for maternity leave and coming back a year later, I definitely felt all the emotions that were mentioned in the video. I doubted, I felt unconfident. I definitely had some imposter syndrome coming back in. I doubted my own knowledge and was worried that I hadn't been able to keep up with current practice. As an anaesthetic trainee, I was worried that my technical skills may have become rusty, and doubted my clinical competence as well. I was also worried about what had changed within my trust in my organisation, and how I was going to fit into that, and how I would be perceived coming back as a trainee, now coming back less than full time, with lots of additional personal circumstances and requirements, for example, childcare needs. And I wondered what support was going to be available, if there was going to be any mentoring or any peer support. Now, at this time, I can only imagine that with the added burden of COVID-19, all those concerns are just amplified. And it is a very stressful time. I'm wondering what would have changed in the work environment. How can you ensure that your work environment is safe, and how can you protect yourself and your family coming back? And those concerns are all completely real, and I'm sure are very much shared amongst people in the group tonight. So who is supported return to training available to? When the program was first introduced, it was essentially available to all junior doctors who held a training number or were appointed to a foundation program, also to public health trainees, military and defense trainees, and dental trainees who had been out of program for 3 or more months or going into a training program. Over the past few months, it's also been extended to include shielding trainees and any doctor who has been redeployed to an area outside of their normal clinical environment due to COVID-19. And of course, for the last 2 groups that I mentioned, the 3-month out of program rule does not apply. What does support actually offer? So there is a lot of regional variation in the supported return to training program, but essentially all local officers will offer funded reorientation days or funded reorientation period to allow the trainee to come back into the clinical environment prior to their return, to shadow, to meet the team, and to reorientate themselves. There's also events and workshops that run throughout the year. These may be simulation events, knowledge refreshers and updates, personal development courses, wellbeing courses, and each local office will run those. There's also the opportunity for coaching, career mentoring, career development as well, and much, much more. In my presentation tonight, I'm not going to talk about the support specific for shielding trainees, as Antonia and Karina are going to chat about that a little bit later. But if you'd like to find out more information about supported return to training, the best place to contact is your local HEE support office. They'll be able to point you in the right direction. Many trusts around the country have also appointed support champions who are consultant champions with a special interest in supported return to training. So it might be worth having a look in your hospital to see if you have a trust champion. And there are also national and regional support fellows as well, like myself and Ceri. If you want to watch some case studies and find some additional resources, the mysupport.com website is an excellent source, as well as the HEE website, which is regularly updated in addition to the HEE Twitter and social media accounts. So thank you very much.
Thank you very much, Aimee. That was a really good overview of the supported return to training programme and what it's been used for traditionally with returning trainees. I'm just going to play a video now from one of the trainees who's been shielding for maternity reasons. It's a pre-recorded little bit of sharing about her experiences and what kind of things she's done while shielding. So I'm just going to play that now.
Hello, my name's Klara. I'm a dually accredited medical registrar, and I was working from home from the middle of April until a few weeks ago because I was pregnant. And prior to that, I was doing a few weeks of non-patient work, but in the department, but I'm now on maternity leave. I'm going to just talk a little bit about my experience during that period of working from home, of what I was doing. I found it a real challenge, partly due to having 2 small children at home, but also just the difficulties inherent in working from home. But I did also want to flag that for me, it opened up quite a lot of opportunities to do things that I otherwise wouldn't have had. So I thought I'd outline those sorts of things that I was doing and talk a bit about some of the challenges involved. So the bulk of my sort of direct patient work was telephone clinics. Initially, this was covering other people's lists who got redeployed. But then later on, as we've all got to grips with it, I've had my own booked-in telephone clinics. I'm lucky in that I'm an ST6, so I'm generally fairly independent in clinic, but it was definitely still quite a learning curve to get to grips with telephone clinics. I had a few chats with other colleagues doing it as well, which was kind of reassuring to know how I was approaching it was right. But overall, I probably actually spent most of my time on sort of not patient contact work. So I thought I would just talk through some of those, because some of those were sort of things that I wouldn't have normally done prior to all this pandemic stuff. We were quite lucky as a group. The medical registrars at my workplace were really proactive. We set up a WhatsApp group right from the beginning of the pandemic, and it generated a lot of plans and ideas of how to work effectively. And we ended up with a representative on the daily bonds management meeting, which meant that we could input those ideas directly there. And once I was working from home, that was one of the things I did, was being that representative. So that was a meeting every morning, somewhere between an hour and 2 hours. Also, as a result of that, then sort of scribbled down the minutes and disseminate those out. We had a cascade system to all the junior doctors in the trust, plus taking back their feedback back to the management meetings. So that was really helpful actually with communication flow and making sure everyone felt listened to. The registrar group also generated quite a few other ideas, such as having a wellbeing lead among ourselves for junior doctors, which is something I took on with one of my colleagues, just being a point of call for anyone who was struggling or was concerned, and signposting them on to appropriate places. I was also part of a smaller registrar rota group, and we wrote our own pandemic rota, which was really nice not to have something inflicted on us by management. And then later the step-down rota, and they're now working on a surge rota for the winter. We also produced quite a lot of guidelines, both clinical and in terms of sort of communication management. And I took on disseminating those, partly via email around everyone, but also we had a trust coronavirus microsite we could upload them all onto. For a little while, I also took some GIM advice calls, so general medical advice calls at homes. So the ones from GPs or other specialties, where it was a call for advice rather than patient review. And if I took those at home, it took some pressure off the on-call team and gave them a bit more time to deal with the queues and the busyness in hospital. Within my specialty department, I had various projects. The most time-consuming was identifying all our shielding patients at the beginning that we had to send the letters to. But later, as people started heading back to work, we had to sort of look at their ability to go back to work, and I ended up writing a template letter for people to give their employers about their risk level. I also updated various department guidelines and writing some new coronavirus-specific ones. Because I'm a relatively senior registrar, I was also comfortable giving some advice to the more junior colleagues as well as our specialty nurses. I also spent quite a bit of time doing remote teaching. So there was a whole stint of doing it for the redeployed doctors at the beginning, but also organising and partly delivering the induction for the interim foundation doctors that joined us for a while. And that's been recorded and carried forward for the August induction. And as things settled down and teaching got restarted, I also did some foundation doctor teaching and one of the regional registrar sessions, all via video from home. So overall, I definitely found I was really pretty busy. A lot of it for me had the advantage of being able to do the evenings once my kids were in bed, which suited me. But even during the day, it was pretty constant. And I would definitely suggest thinking about your time management when you're planning what you're going to do. There were some definite challenges in all of this. Keeping in contact with everyone was definitely a big one. And I was going to talk about a little bit more about that, how that worked for me in a minute. The IT was another issue. I only managed to get to set up for home IT access about 24 hours before I started working from home. And it went down, various bits of it went down really quite commonly. Fortunately, most of our systems were already electronic, although, for example, prescribing wasn't, which isn't great for telephone clinic. And I ended up trialling for pharmacy, after querying how to do that, an electronic prescription, which they then used trust-wide. So it's definitely worth flagging the issues and seeing if you can make suggestions on how to manage that if the IT isn't there in place. Another big problem I found was the constant change of how things were working at that point. It was much harder to keep track of what was happening with not being on site, to stay in the loop. You didn't get those chance meetings where someone said, oh, did you know this is now, or they're not in this. The WhatsApp group really helped with that. As a lot of those chats moved onto there, we were running at 100 messages a day at various points about work stuff. But I also found I needed to be really proactive about chasing up what was happening. So my clinic bookings, the latest protocols, what we were, what we weren't doing. Also, the management meetings really helped with that side and made me feel more in the loop of what was going on and involved. So in terms of staying in contact with people, I was lucky. I had a really supportive department in that respect. I had mobile numbers, email addresses for everyone, all my consultants in the department, and they were happy for me to use at any point. I did have an assigned consultant to contact for clinical advice, but if I needed urgent advice and they weren't available, anyone else was happy to help. I found it was generally easier to use email as the first port of call, because we otherwise spent a lot of time chasing each other down with missed calls backwards and forwards. So generally an email to arrange a time to call seemed to work best in terms of asking for advice or just catching up on what was happening. Because of all the management side, I also ended up developing quite a lot of contacts with HR, the medical education team, as well as people like the Guardian of Safe Working, pharmacy leads and people in IT. And having those in place and knowing who to contact about what made it much easier to do all these kind of slightly off-the-cuff projects that I wouldn't normally have taken on underway from home. Because phoning up and going through switchboard is a nightmare to get hold of people. So the direct contacts is really worth establishing a list of. I've already mentioned the Registrar WhatsApp group, which really helped with keeping me in touch with the general medical side of things. But we also had a department specialty one, which was really helpful too, to know what everyone else was doing and when and who I could contact. All the meetings in the trust were already set up via Teams or other video calls. So that was really easy just to join into. I didn't have to adjust anything. Our medical education team set up quite early for doing remote teaching, and they had someone on site to troubleshoot when it wouldn't connect, which was also really helpful. I think one of the other big challenges for me that I thought was worth working was the emotional aspect. I felt hugely guilty at not working on the front line, having essentially walked out of work and not being exposed to the same risk of my colleagues. I don't have a great solution for that, but I would suggest if you're feeling that way too, then go and talk to your colleagues, because mine were incredibly supportive and really reassured me that they were not blaming me, that they were grateful for the things that I was doing, and they would much rather that I didn't turn into one of their patients. My other big worry was about how my training would be affected. There's a lot more guidance now about training and how it works, so I think that's going to be a lot clearer from this point forward. But I was really careful to keep a log of what I did every day. And I did a lot of reflective logs, particularly on the management and leadership side of things. I also did some assessments done on my telephone clinics with the patient's permission to record them and then email them into my supervisor. And I kind of was as proactive about getting as much feedback as I could from everyone about what I was doing. Our management team were really proactive about sending emails thanking and praising people for their work, which was really nice. So I put those in my portfolio, but if they're not sending them to you spontaneously, I'd definitely ask for them. And so I think that was really helpful. I also found that I think generally my supervisors and my colleagues weren't really sure what I could do when I was working from home. So part of this support group, we've put together a document with a list of ideas for you that you can take to your supervisor meetings and explore as possibilities. But I do think it's worth remembering that this is as new to them as you. And I found that trying to be really proactive and consciously looking for projects and ideas to take on really helped, both actually in terms of widening my options of what to do and making it more interesting, but also in terms of the relationship with my supervisors and colleagues. And 90% of what I did was at my own instigation rather than something that I was assigned. And I think that's actually what made so much of what I did actually really helpful and useful for my sort of own development, as opposed to just feeling like I was searching for something to do for the sake of it. So that's just an overview of sort of my experience of working from home. Obviously, everyone's going to be different depending on your specialty and things, but I hope that's given you some idea of what it was like and some ideas and areas to explore.
So obviously that's just one trainee's experience, and we know that it will be very different according to different individual circumstances, and also the accessibility of supervision and accessibility of contacts within your individual trusts. But I think it's really nice to get an idea as to some of the things that Klara has been through and some of the links that she found really useful, and hopefully that's been quite a good kind of overview for you from her experience. I'd like to hand over to Alison Gayle now, who is HE Associate Dean for Supported Return to Training in the North West. Hi, Alison.
Hi. Thank you, Ceri, for that introduction. I am an Associate Dean working in the North West for 50% of my time. I'm also a consultant obstetrician. I'm speaking today really to share some of my experience because I was shielding for 12 weeks while I was immunosuppressed, although I have now been back in the workplace for 5 or 6 weeks since. I really would like to reiterate a lot of the things that Klara has said, particularly the guilt issue, and the fact that when you're at home, you try and fill your day, and you probably do an awful lot more at home, working from home, than you would have done in the workplace. I certainly found that through guilt of not actually being there and supporting my colleagues and going through what they were going through. When you return, discounting the shielding, the concerns that Aimee talked about really are there, the confidence, the worry about decision making, your well-being, your time management, other stresses that you have. Thankfully, I didn't have many of those, because while I was working from home, I took on all the clinical governance for our maternity department, which those of you who do obstetrics will know is absolutely huge. So I was dealing with complaints and guidelines and investigating incidents, feeding back to patients and families on a regular basis, and looking and analysing incidents. So my non-technical skills and generic skills weren't affected. The only thing I really felt rusty on when I was going back was the practical hands-on procedures that I hadn't done, but only for 3 months. My biggest concern and change going back was what the new world looked like in hospital settings in our maternity unit post-COVID. And certainly when I went back, I wasn't prepared for the complete change that everybody who was working had accepted, in that you wore your full PPE or part of your PPE for different things. Everyone was walking around the hospital with gowns, masks, gloves, aprons every time they saw a patient, that we had to change in between. So I think my advice to you probably not just is update yourself on the changes in your guidelines due to COVID, and they'll be significant, but also if you can, before you go back, go and work out what PPE requirements are for where you're working. Get yourself fit tested so you're provided with the appropriate PPE to maintain your safety in the workplace. And I think if you manage to do that before you go back, a lot of the anxieties that you're worried about will be relieved a little bit. That's really all I wanted to share at the moment, but I will be sitting on the panel if there's any questions at the end. Thank you.
Thank you, Alison. That's really, really helpful. And I know it will be really useful for some of the trainees that are preparing to return over the next week or so, to kind of hear some of the feelings that you've come across, even as someone relatively senior, and that it's okay. And we know that from many of the returners and people that have had time out of training, even if they've been managing to do virtual clinics, etc. at home, that a lot of the impact on confidence and the worry about loss of skills is really, really important. And it's really nice to hear that from you as well. I can see that one of the comments in the Q&A is related to the difficulties that some trainees have in the onus being put on them, and the difficulties in accessing resources from trusts, and that can be really difficult. And I know that Klara has given her point of view from a trainee who's quite experienced and had access to a lot of those channels and knew the trust that she worked in quite well. But we'll touch upon that in the panel discussion, because we know that that's not the situation for everybody, and that it can be really difficult to do everything yourself as a trainee. And it's nice that we've got so many trainers and supervisors logged into the session and also part of the panel, because that's a really important part, to be proactive and available for trainees that are in this really difficult situation. I'm going to hand over to Antonia Calogeras, who's one of the who is the HEE lead nationally and Associate Dean for Supported Return to Training, and Karina George, who is an Education Programme Manager at Health Education England in Wessex.
Thank you, Ceri, and I just wanted to thank all of you for joining. Thanking Ceri and Aimee for leading the great work that the Shielding Trainees group are doing, and we'll touch upon that in a little more detail in a moment. It's great, as Ceri says, to have so many trainers on the call as well, because you're really key to this working well. And thank you to Klara and to Alison for sharing your personal experiences. we recognise that these last few months have been very difficult for everybody, but that those of you who have been shielding have had additional issues and concerns, and we recognise that and really want to, whilst shielding is, as I'm sure you're aware, essentially an employment issue, HEE are very, very keen to provide whatever support we can. And we have put together a slightly amended support programme for those of you who are shielding, whether you're continuing to shield, whether it's by proxy, whether you're returning or have returned. And Karina is going to tell you a little bit more about the detail and will certainly be available to answer questions in a little while. Ceri is also going to show in a moment the flow chart and checklist that has been put together to support the policy, the supported return to training shielding trainees policy, which hopefully is in the final draft. Some of you may have seen versions of it already. It's important, I'll say this, although there is an occupational health webinar being planned by Ceri and the team within the next week, and dates will be made available to you as soon as we have confirmation of them. I probably don't have to say, to reiterate, the importance of having a risk assessment by your occupational health department. Hopefully you've all had one at the start of shielding. You'll be aware that the guidance is shortly to change from the government for those shielding due to community levels of exposure. Those of you who are in clinical environments, would be going into clinical environments, clearly need a slightly different assessment to the general population. And so I just wanted to emphasise the importance of ensuring that you have your occupational health departments go ahead before you re-enter the workplace. As I say, I don't really want to say any more about that, because there will be a webinar which I'd encourage you to attend within the next few days, run by an excellent team of occupational health doctors who will hopefully be able to answer more detail around that. In addition to the policy and what Karina's going to talk to you about in a moment, the team led by Ceri and Aimee have put together a webinar series and some additional resources specifically for those of you who are shielding, and they'll be made available to you as soon as possible. And we would encourage you all, as been said already, to engage and make contact with your deanery, your own deanery's supported return to training team, who will give you more guidance and will have many resources available to you. I think probably I don't need to say any more at this point. I will hand over to Karina to talk a little bit more detail of what the process is there to support you. The focus of the policy is really threefold. One is to ensure that you, while you're shielding and during your return, are supported as much as possible, including your well-being, and other aspects that are important. We also want to ensure that your training and educational and development needs are met as much as possible, to ensure as far as possible that your progression can be optimal, and also to reduce the impact for those of you who have yet to return, of returning back to the work, which are essentially the ethos of the supported return to training programme, but moulded slightly to address your specific needs as doctors who've been shielding. So I'll hand over to Karina at this point. Thank you, Karina.
Hi, so I'm the programme manager, and one of the areas I look after in Wessex is supported return to training. And what's been decided is that across HEE, that actually that shielding trainees should have access to supported return to training and the resources that we offer to trainees. So next slide, please, Aimee. So I've just got a couple of slides just to talk to you a little bit about the process for supported return to training, and how this applies to shielding trainees. So there's been some guidance that's come out from HE deans, but this is just going to talk to you a little bit around what we would expect shielding trainees to do across the board. So what we'd really recommend is that if you haven't, I'm sure you've already, but having a meeting with your educational supervisor or appropriate educators, that could be a college tutor, a training programme director, is really, really important. And especially for those of you who are going to be returning back into a clinical environment shortly, you really need to have those conversations as soon as possible, and just talk around the work you've been doing, and any concerns you might have about returning, or any questions that you have. And I think certainly don't be afraid to ask any questions, even if you think even if it's around about IT equipment, however small that question is. Do ask those things before you return. But you should be using those meetings with your supervisor just to talk through what you're doing. What we're recommending is that all trainees who are going to be continuing to shield past August, that you complete, it's called a pre-absence form, and I know that you're not out of training, you're not absent, it's just this form is a really good way of framing that conversation with your educational supervisor. So it's just an opportunity for you to talk through what you're going to be doing whilst you're working at home, and also to develop a personal development plan. And that's where, as Alison and Klara had said, about coming up with any ideas you might have about the sorts of things you're going to do while you're shielding and working from home. I know there's a number of people who are shielding because of pregnancy, and what we recommended, if you can do, is to do one of those pre-absence forms as soon as possible, but then you just need to do another one before your maternity leave starts, as that pre-absence form will just go through the sorts of things you might do during your maternity leave, just to keep in touch, any sort of updates you might want to do while you're on maternity leave, and also just maybe have a think about the sorts of things you might want to be doing when you do return to the clinical environment after your maternity leave. We're recommending that trainees, you should have them in place already, but do have regular meetings with their educational supervisor. So we're advising that ideally weekly or bi-weekly, but they should have regular contact to check in with their educational supervisor, and check in with the work you're doing, get some guidance about that. What we'd also recommend to all shielding trainees is to contact your local support team about the activities that are going on at the moment for shielding trainees. So quite a lot of the HE offices are running events, activities for shielding trainees, or they're running other training that's completely relevant to you. So that could be a course around webinar around wellbeing, and that could be a webinar about something like teleconsultations. There's sorts of activity going out there, and the sorts of things that you could be taking part in. So for those of you who are going to be going back into training shortly, and of course it's applicable to anyone who will or out of training, you need to really plan your return in advance. So it's really, again, having those meetings for educational supervisor, building up to talking about that return. We have another form. We do like our forms in HE, but we do have, all local offices have a pre-return form that we ask trainees who've taken time out from training, or in your circumstances have taken time out of been out of the clinical environments. So do complete that return form, and do return that to your local support team. Again, that form is really good at just framing the conversation about your return, and covering things, any sort of things you might want to do in advance of returning. I think, as Antonia said, we can't emphasise enough about following the advice provided by your occupational health team and risk assessment. So in those conversations with your educational supervisor, it's really important to be following that guidance for your return, and just ensuring that your educational supervisor knows about any of those issues, and that's also cascaded down to your department as well. And then it's also an opportunity in that pre-return conversation is just to talk about any resources that you think might help with you returning back to clinical environment. It could be as simple as Alison was saying about feeling ready for the PPE, getting fitted for the PPE, but also thinking about what you might want to do in those first few weeks back in clinical practice. So thinking around perhaps an enhanced supervised period, shadowing, supernumerary time, and then again any courses, any online courses that might be relevant. I know some trusts are running some very small group sim courses, so it's a really good opportunity just to think about the sorts of things that are going to really help you in those first couple of weeks and in advance of returning to feel confident getting back into the clinical environment. The final slide, Aimee, please. And this is just your support contacts in your HE local office will really be able to support you during this time. So I've just put up a list there of the email addresses, and I really would recommend, if you haven't already, get in touch with your support team. And they're aware of they're all aware of the support that's available for shielding trainees, and they'll be able to point you in the direction of any resources that they're running. And that's it from me.
Thank you, Karina. That's really helpful. Just to kind of see how things work from a local office perspective, and some of the forms and the timings of things, we'd really encourage you to speak to your local supported return to training office and have a look on the local HEE website as well. There's a national page, but there's also a page for each region, and you can usually find lots of really good information as to what happens in your region for supported return to training normally, and also access those forms as well, so that you can kind of make the office aware that you're thinking about possibly returning, or whatever situation you're in whilst shielding. I'm just going to try and share some of the resources that Antonia and Karina have touched upon. Now, we tried to bring together a group of fellows and shielding trainees for different reasons to uncover some of the difficulties and some of the problems. Over the last few weeks, we have put together a few guidance documents. They've been circulated around different regional support offices, so they should be making their way to you, or will shortly be available. So one of the documents that we've developed is a guidance for trainers and supervisors, but this can be really used as a tool to help you know as a trainee what kind of things you could discuss with your supervisors and trainers, and when you should be looking to have meetings with them. Particularly, I know it's really difficult when trainees feel like they're having to push forward, and this can be a really useful tool to say, okay, well, it would be really good to have this conversation at this point. So you can see that we suggest an initial meeting as soon as you can, really, and that can be now, or it could be something that you've mostly covered, but you just want to address some of the points that are in this guide that haven't quite been touched upon yet. While you're shielding, and if you're continuing to do so, we would suggest a meeting with a supervisor every 1 or 2 weeks, and that can be as informal or as formal as you would like it to be between the two of you, and that can be obviously virtually or by phone, just to touch upon some of the progress that you've made while shielding, and keep on thinking if there's any adjustments needed to that personal development plan, or resources or opportunities within the trust, and as things change, is there anything different that you can think about. A meeting before you return, as Karina's touched upon, and it's also a really good idea to arrange a return review as well, so either a few days, a week, a couple of weeks after you return, depending on obviously the speed of your return and when you feel it's most appropriate to do that, to have a look at what's been in place since you've returned, and are you in a position to go back to full clinical work, or have those adjustments that have been made, or the area that you're working in, is that an effective change, and is there anything new that needs to happen to make you feel safe in that environment. So that's a really good kind of safety checkpoint. So I'd really advise you to talk about that with your supervisors or trainers if you are returning shortly. There's just a run through checklist of some of the things that you might want to discuss with your supervisors, from looking at the curriculum and things that will be easy for you to do while you're shielding, or areas like leadership, management, exams that can be done from a virtual environment. And signposting to resources, particularly the risk assessments and occupational health. And I know that some of you will have been through this already, and that it's not as straightforward as a checklist, but to engage your supervisors in those discussions and to have something as a guide as to what kind of places may be useful for you is really good. There's some advice of discussion points for those meetings while shielding, and as mentioned, the pre-return meeting and the return review meeting as well. This flowchart runs alongside the supported return to training and the HEE postgraduate dean's guidance as well, which focuses on some of the progression points and some of the other challenges. But in terms of returning to training, this flowchart outlines again some of the meetings in quite a brief, straightforward point of view. So that's quite useful to have a look at as a brief guide as well. I know that in the chat, and also Klara's mentioned in her experience sharing, that it's really important to stay in contact with other shielding trainees, and that can not always be the easiest thing to do. She's mentioned that there was quite a few within her department, and they were able to set up a WhatsApp group, which is really useful. But just to point out, and we will put the link to this resource list in the chat towards the end, but there are a few links to some of the important guidance from HEE, from the BMA, from NHS employers and the Occupational School of Medicine. And down at the bottom, there is also a Facebook group and a Twitter network, which have been set up by a really enthusiastic, really passionate trainee who will be part of our webinar tomorrow, looking at the impact of shielding on doctors and healthcare workers. But I'll post in some slides at the end the links to that Facebook group and the Twitter group, but they're a really supportive group, and there's lots of experience and idea sharing that happens in them as well. They're not associated with HEE, they are informal groups, and they're trainee led, but they've been really useful, and I can't thank the people within those groups enough. Okay, so we're going to try and discuss some of your questions now. So I'm going to open up to the full panel. Okay, and I'd like to welcome Klara to the panel as well. I know we've shared her experiences through the recorded session, but she's kindly in the middle of looking after a newborn baby and maternity leave, been able to join us for the end of the session. So thank you very much for that. So one of the things that I wanted to touch upon was there's been mention in the chat that actually a lot of the onus seems to be on trainees, and that they can sometimes feel quite isolated from others, and potentially feel like they're taking the lead in contacting supervisors, etc. We've talked about accessing the support programme and their regional offices, and I think that will be really useful. But have any of the panel got any more bits of advice or routes that trainees may be able to take if they're feeling a little bit distant, or for example not having much in the way of accessibility to IT or virtual clinics or working from home.
Ceri, I think the other thing that may help trainees if they really are struggling with contact is speaking to their support champions, either within the schools or within the trusts. And certainly that's something that is available throughout England now for all trainees. And that offer will be for shielding trainees as well as those that are not shielding. So I would advise if they're not getting anywhere with what they're meant to be doing and their education supervisor doesn't seem to be on board, I'd perhaps seek the support of the support champion who may be able to help.
Yeah, I would echo that. And there are often support champions within your trust, but there are also in some regions specialty support champions that can be quite useful, particularly for the craft specialties, because they may have a slightly different take on procedures, etc., or skills that you need to keep up. And there is also often guardians of safe working, which I know Klara has mentioned as well in her experience, which can be a really useful resource in trusts as well.
I was going to add to what you have said and Klara said previously, and Alison, to say that certain things to do with IT tend to be employer issues. And so there are other people in addition to those within a trust that may be able to help you. So the Director of Medical Education is someone who may be able to help, and also the clinical lead of your department. There may also be, in some specialties, a college tutor within your department who has an educational remit, who may be able to help. There are also people within the HEE system that can help with some of the other things. So there was one question posted around what happens if my ES is reluctant to have the conversation with me. Sorry about that. What do I do if my ES is reluctant to have the conversation with me, even though the guidance that we've issued has been shared? I would suggest that you approach either the individuals we've talked about within the trust, so your college tutor, your support champion, or your Director of Medical Education, or alternatively your training program director, or even head of school, but I would go with the training program director first. Sometimes educational supervisors feel they don't have the skills or knowledge to have those conversations, but somebody within the educational system should be able to have that conversation with you. Thank you.
Someone's mentioned the possibility, obviously, of further episodes of shielding, and that although this is a pause, and obviously there are many that are continuing to shield, but some that are going back or going back to adaptive roles over the next few weeks. Is there any kind of advice that people have in terms of the flexibility of the support programme in that situation? I think it's very difficult because, again, it's quite trust related and quite dependent on government advice as well, which is a little out of our hands. But it's something that's been mentioned, so I don't know if anyone's got any ideas that they wanted to.
I just reiterate what Ceri has said, first of all, that the decision about shielding or not shielding is an employment one that must be guided by an appropriate risk assessment done by the OH advisor for the trust. However, to answer the bit around support, support is available for anybody who's shielding at any stage in the process. So if you were to be in a situation where you came back and then had to shield again, I would encourage you to take advantage of whatever is available through the support program in your local office. But certainly the policy that we are talking about today would apply to you throughout any future shielding experiences. And I would encourage you in that situation, as soon as it seemed as if you were going to have to shield again, to have that early conversation with your ES, drawing on some of the things that Klara and Alison have mentioned around how to maximise what you're doing while you're shielding, and also the document that the STAG group have put together with guidance on that, so that you have an early conversation and plan what you can do to maximise your training and education during any future shielding episodes. Hopefully that answers that bit too.
There's a lot of discussion about people that are obviously there's a large segment that are still considered to be very high risk. Actually the majority of trainees that have been shielding, even though there's changes in guidance for the general public, the risk for healthcare workers is quite different. And I know, again, this touches upon employment law and risk assessments and occupational health. And I would point people towards the webinar that's going to be run in the next few days for a bit more detailed advice on that. I am about to post into the chat the link for the HEE training guidance. Within the first paragraph of that, there is also a link to some employment law, and that's quite useful. Antonia, is there anything you wanted to add to that?
Thanks, Ceri. I think it is probably covered in the documents that you're going to post in the chat. I just want to say that there is some guidance to employers around the issue, and there have been several questions around this. What happens if your OH department deems you fit to work, but you have your own concerns? That's something that needs to be taken up with your employer. So I suggest going first to the clinical lead. You can try your ES first. I suspect they will feel that they're not in a position to guide you. And so your clinical lead would be another person to go to. But the guidance that is given to employers is that whilst it is their ultimate decision about whether they listen to you and follow what you'd prefer to do, or listen to their OH guidance, generally it's recommended that it needs to be done in collaboration with the individual, and that applies to all healthcare professionals. So I would suggest that if you are in a situation where you disagree with your OH assessment, that you take it up in the relevant channels with your employer, because it's very much an employment issue. I don't know if anyone wants to add anything to that, but I would encourage you to read the documents that Ceri's posting, because there is guidance in the HE shielding paper, and also in some associated documents that will help with that, I feel.
Sorry, I'm just in the middle of trying to find links to post as well, but I will filter them through in a while. One of the other things I wanted to talk about is that there are a few questions mentioning shielding by proxy on behalf of others. Now, from a supported return to training point of view, that doesn't make any difference to your eligibility for supported return to training whatsoever. So if you have had a change in the way that you're working, or time away from your normal clinical role, then please do access supported return to training, even if you feel that you are moving into a different accommodation away from that, or circumstances have changed, or the guidance for your family member or loved one that was previously shielding has changed, then all of the supported return to training principles still apply to you, and I would certainly encourage anyone who's had a change in circumstance and may still have the impact of confidence and worries about their training to still access support. So some comments within the questions regarding transition points of training. Now, again, I know this isn't completely covered by supported return to training, but it might be worthwhile just pointing those that have asked questions about that towards the HEE training guidance that I've posted. There's also some good documents from the BMA which are on the resource list, which will be circulated via the slides at the end, because we recognise that actually some of those training progressions and you know, if you're coming close to a new phase of training, or if you're due to complete your training, etc., within the next few months, and this can have a massive impact on your future career plans. But I would just say open those discussions with your supervisors, try and get an individualised approach to what you can be doing to kind of evidence that, or what is the best plan forward for you. I know there was a webinar about OOP pause, and that's not perfect for everybody, but there are options like that that can be discussed. So it's a little outside of the supported return to training remit, but I would point you in those directions.
Ceri, there's a few questions about exams, that shielding trainees have been able to do exams even when they're rerunning because they still need to socially distance. I think a lot of the colleges are very aware of this now, and certainly I look after the emergency medicine school, and their exams are all going to be virtual and electronic, and if you can't get to a centre to do it using their IT, you can do it from home with appropriate evidence of sanitisation of the place that you're doing it in. So I think the colleges are on to that. So it may be worth contacting your college if you're waiting to sit an exam to see if there's any possibility of doing it virtually.
Karina, do you have any advice for people in terms of the best way to let their local support offices know that they are shielding or that they want to access the programme? Is it worthwhile just looking at the web page first and filling out an online form? What do you think is the best kind of first step for people?
First step is to have a look, so each local office will have a page on supported return to training, and that will give them information and access to the pre-return or pre-absence forms. We'll also give an email contact, so certainly email your local office, and if you are returning, something I think was raised, if you still need to do a pre-return form even if you're returning next week, yes, I would certainly recommend that you see if you can book some time. You can do that over a video call with your educational supervisor. But yeah, do have a look at your local offices supported return to training web pages and forms, and also the HEE supported return to web site also has links to some knowledge refresher webinars and lots of information on there as well. I think you've got that in some of the information you're sending, Ceri. But yeah, certainly make contact with your local HEE team.
I'm just posting the main national HEE website into the chat. That will give you a little bit of general information about supported return to training, but at the bottom there is also all of the contact lists that Aimee had on her slides for the regional offices as well, so you'll be able to find contact details for them at the bottom of that page. At the top of that page, there's also a link to a set of webinars that were previously run for the returning group at the start of COVID, and there are a lot of clinical refreshers for different specialties. So some of them may be useful kind of updates for you, and there are a few kind of well-being sessions as well, so imposter syndrome, how to deal with some of the emotions that have come up during coronavirus. So it's worth having a look through them to see if any of them are relevant for you. And underneath there is also a set of pandemic podcasts as well, which have been run by one of the professional support and wellbeing offices, and they have some sessions that are really, really relevant. So for example, there is one about workers on the sidelines and on the front lines and people's experiences and how they've managed those feelings of guilt that some people have touched upon in the chat, or am I doing enough, and feeling quite distanced from all of the rapid changes that have been happening in a clinical environment. So they may be quite useful to you as well. Klara, I know you've talked about a lot of your experience already. Some of the comments that were mentioned were about it being quite difficult for people to be as proactive as you've been, and maybe not having accessibility to some of the resources to work from home, or being at different stages of training or different individual circumstances that mean they're not quite so confident to do that. Do you have any advice for for them at all?
Yeah, so yeah, no, absolutely. Being a senior trainee has definitely made things easier in terms of being able to do some work from home. I actually only went back to started at my trust about 6 weeks before going off, so I had really not got my feet on the ground in terms of how things worked. So I would say it is definitely still possible to find the people and make the contacts, but it is quite hard work. In terms of IT, which I think is a big issue for a lot of people, perhaps it's not the approved route, but I would go, my personal experience is that going to IT directly has much more effect than trying to go through someone else to sort it out. If assuming the IT it's technically possible to do it from home, I didn't really get anywhere going through the approved channels. As I said, it only went in place the day before I started working from home, and I basically emailed IT every day and annoyed them until it got done. But I think my main thing from talking to colleagues actually is that you don't have to be doing everything. You know, you do what you can, and everyone understands the situation. You know, this is a totally new thing that none of us have had to deal with. You know, do what you can, pick up what you can, and people appreciate you doing what you can. No one expects you to be able to do, you know, on call from home. You know, it's not like that. And my personal experience that I felt much more guilty than other people have made me feel, if that makes sense. I think it's been a self-driven thing rather than something that my colleagues have put on me. So, you know, if you're in the situation, the IT is not in place, you know, you've got not much experience in your specialty, you're finding it difficult to find things you can do from home, don't feel guilty about that. That's the situation. I think it's just worth trying to maximize what you can do and thinking outside the box a bit, as it doesn't have to be kind of classical things that you would normally do. And I'd say most of what I did is stuff that I would never have occurred to me to do anything with before this all started. So that helps at all.
Yeah, I think that's really helpful. And again, it's useful to hear some of the experiences that are shared on Twitter and in the Facebook group, because everyone's circumstances are just so different, and there is no right way to deal with this situation. I would just completely echo what Klara said. Antonia?
I was just going to add to that those helpful comments of Klara's, that the webinar tomorrow night will address some of those issues that have been raised around guilt and other things, specifically for those of you who are shielding or have been shielding. So I would encourage you to sign up for that if you haven't already.
Thank you very much to everyone that's been involved in the panel. I think there's been some really useful discussion there, and I hope that it's been helpful for everybody. Thank you very much, all of you, for joining us this evening. Whether you're watching the live session or the recorded session, thank you for giving up your time. Please do watch the other sessions. They'll be available as recordings on the Supported Return to Training Health Education webpage. If you look for digital resources for support, then you'll be able to see those alongside some of the clinical refresher webinars and the podcasts that were mentioned during the session. If you do have any suggestions for further webinar subjects, please do feel free to send them to us. You can do so by going to slido.com, put in the event code #topics, and there'll be a poll and a Q&A. Feel free to write anything that you would suggest into there, and we will try and do our best to consider any of the suggestions you give us. On the same page as the recordings, you will also find the links to all of the guidance documents and resources that we've discussed in this webinar. So please feel free to click on those links, look at those, and use them as you feel most appropriate. As mentioned, there is a Facebook group which is not affiliated to Health Education England, but is a really widespread group now that's expanding, and there's a wealth of information sharing and really good peer support within that group. If you type Shielding Healthcare Workers into Facebook or go to bit.ly/Shielding Healthcare, you will find the page there. There's also a Twitter group with the handle @ShieldingDoctors, and again, lots of information and resource posting available through that group. Also like to discuss a project called the Distance Aware Project, again not affiliated with Health Education England, but it's been really really good and is growing in awareness and numbers. If you go to www.bevancommission.org/distanceaware or look at the Twitter handle @distanceaware, you'll find some links to this visual symbol. It's available in lots of different ways via lanyards, badges, posters, etc. And it's a visual aid for those that are high risk or that are coming out of shielding during the pause, to serve as a visual reminder of social distancing to others, and that may be really useful for you if you're returning to the clinical area at some point in the future. Thank you very much for your time and for joining us. Please do have a look at the resources and view any of the other sessions. Thank you so much.